One of the most impressive things about the RESTORE study is that it was conducted on patients with carbapenem-resistant infections, including CRE and carbapenem-resistant Pseudomonas. These types of studies are particularly difficult to do because you're not only identifying good study sites that have strong leadership and good research infrastructure, but you actually need to find sites that have the resistant pathogens as well. So your eligible potential sites are limited in number. Also, the types of patients who develop infections with carbapenem-resistant organisms tend to be much sicker, with a greater both acute and chronic severity of illness, and just can be more complicated to enroll in clinical trials. So in many ways, there's a RESTORE and studies like it that focus on highly resistant pathogens are extremely challenging to conduct. Imipenem-Resistant is an old friend to the ID clinician and to clinicians in general. A broad spectrum agent against both gram-positives and gram-negatives with a particular niche for Pseudomonas and for ESBL-producing Enterobacteriaceae. Unfortunately, over the years, resistance to imipenem has increased in organisms like Pseudomonas, and also more recently among the Enterobacteriaceae, primarily due to carbapenemase production, most commonly in the United States due to KPC production. That's where relebactam comes in. And combining relebactam with imipenem-Resistant restores imipenem's activity even in the face of imipenem-resistant Pseudomonas and in many cases imipenem-resistant Enterobacteriaceae. So by offering strong inhibitory beta-lactamase activity, it puts imipenem back in the driver's seat in these increasingly resistant bacterial infections.